Hello friends, welcome back to your own YouTube channel Vision Care Advisor. Friends, today we are going to explore a fundamental diagnostic tool, the cover test. Whether you are a student in optometry, a healthcare professional, or just someone interested in learning more about eye examinations, this video is for you. The cover test is a crucial tool for detecting eye misalignment and assessing binocular vision. So, let's dive in and learn how to master the cover test. So, let's know what is cover test. The cover test is used to determine the manifest squint or manifest strabismus. So, with the help of this test, we can check either manifest squint is present or not. In the cover test, we have to observe the movement of uncovered eye, not the undercovered eye. Okay. There are two types of squint. One is manifest squint and another is latent squint. As we know, in manifest squint, the deviation or misalignment of the eye is noticeable all the times, while in latent squint, the deviation or misalignment of the eye is hidden. That can be noticeable only when binocular vision is disrupted. Now, let's know what is the target. It can be performed for near and distance. At near, an accommodative fixation target should be held at a distance of 33 cm, and for distance, the fixating target should be at a distance of 6 meters or 20 feet. For near vision, you can use the pen as fixating target, and for distance, the Snellen chart would be the fixating target. And the visual acuity should be less than 6/9, means it could be 6/12, 6/15, 6/18, etc. Okay? If patient has refractive error, he should be wearing his full refractive correction. Now, let's know the preconditions. It is important that patient should have sufficient vision to see the target. Patient should have the central fixation in both the eyes. Latent nystagmus should not be present in the patient. For children, very small picture like those seen on a Lang stick can be used. Now let's know the procedure. So, patient should be seated comfortably. Then, ask the patient to fixate a point straight ahead with open both eyes, with no abnormal head posture. Now, an occluder is required to perform the cover test. In case of children, you can use your hand to cover either of the eye to avoid scaring the child. Occlude one eye, either left or right, of the patient and observe what happened to the other uncovered eye. Either it moves to take up the fixation or not. Then we have to notice that if there is no movement in the uncovered eye, the patient's uncovered eye is orthotropic, means it is normal aligned eye. If there is a movement in the uncovered eye to take the fixation, the patient has a manifest squint in uncovered eye. Repeat the same procedure of the cover test on the other eye. Now, let's know the interpretation of the cover test. So, just assume you have a patient. So, this is case number 1. Okay. In this patient, the right eye seems fixating eye. So, when we covering the right eye, the left eye is moving inside, means towards the nose. Now, you have to remember that when any deviation is present, the patient's eye would be moved opposite direction to take the fixation. So, in this case, the uncovered eye is moving inside towards the nose. That means the patient is having exotropia. Now, when we covering the left eye, there is no movement in the right eye. That means the right eye is fixating eye and is having a normal state. Case number 2. In this patient, the right eye seems fixating eye. So, when we cover the right eye, the left eye moves outside, means temporal side. It means this patient is having esotropia. Okay. Now, when we covering the left eye, there is no movement in the right eye. So, the right eye is in normal state or fixating eye. Let's go with the case number 3. In this patient, the right eye seems fixating eye again. So, let's cover the right eye and check the movement of the left eye. When we covering the right eye, the left eye seems moved down. That means in the left eye, the patient is having hypertropia. Now, when we are covering the left eye, there is no movement in the right eye. That means right eye is in normal state or fixating eye. Now, come to the case number 4. In this patient, right eye seems fixating eye. So, let's cover a right eye to check the movement in the left eye. When we are covering the right eye, the left eye moves upside. So, in the left eye, this patient is having hypotropia. Now, when we are covering the right eye, there is no movement in the left eye. That means the left eye is in normal state or fixating eye. I hope this video would be helpful for you. Thank you for watching. Stay tuned for more updates.